Salam and peace. This is Imam Malik Mujahid, and you're watching Muslim Network TV. We are always there on Galaxy 19 satellite, Amazon Fire TV, Apple TV, and Roku. Whole lot of social media as well, but always on our website, muslimnetwork.tv. Despite Obamacare, what took care of a whole lot of people, 27 million adults in the United States still don't have any coverage. And tens of millions are undercovered, underinsured, that is. So who is filling that gap? Many of the faith communities sometimes rise up to start clinics, and so does the Muslim community. At least there are 70 clinics run by Muslims throughout North America. Some of them started off to serve all, some of them started off to serve underserved Muslims, but now half of all of them, not half of all of them, but all of them, half of their patients are actually people of other faith. In some case, majority of the people they serve are people of other faith. That's good. That's the beauty, and that's the faith. Virtually all of them are low-income, uninsured, or underinsured people. This is a story which is not told, as you also do not know that 10% of all patients, 10% of all physicians 10% of all physicians saving lives in New York during the pandemic were Muslims. Some of the Muslim physicians, their license has expired. They renewed the license and started serving. And some of them died while serving people like that. Thank you to all of them. But to discuss what Muslim clinics are, we have two people, one who leads the effort as president and another who as a physician have led an effort of similar nature. Please welcome Adil Sayyed. Assalamu alaikum.
Wa alaikum assalam wa rahmatullah. Thank you so much for having me.
Well, thank you for coming on board. And Dr. Shakil Ahmed. Thank you so much. Assalamu alaikum.
Salam. Thanks for having me here.
Adil Sayyed is president and CEO of Ummah Clinic in California. This was the earliest clinic run by Muslim I ever heard of, though I could be challenged by someone whose history I may not be aware of. And Dr. Shakil Ahmed is chairperson of the board of directors of American Muslim Community Centers in Florida. And they also have at least one clinic which they run there. Well, thank you so much for the great work which you do.
You're welcome. Thank you.
So how are these clinics doing during the pandemic? I remember interviewing you, Dr. Shakil Ahmed, in early May, when we have just begun our Muslim network, airing it on satellite, and you were serving in the area of testing people. So how is that effort going so far?
Well, we're still doing the pop-up testing. However, the frequency has gone down, and it's just primarily because of non-availability of the test kits. So we depend on our county and our government to provide us with the testing kits since they're really expensive. And lately, they have not been as active. So it's maybe a lot of politics behind it. Our Seminole County Health Department, who we work with, they have been struggling to get the test kits as well. So they have kind of limited the pop-up testing, but we have been part of those pop-up testing. We have a mobile clinic that we take to those sites, and we have almost like about 10 to 12 tents and the testing sites set up in the parking lot of churches and malls and the other big centers. And the people in the scores come. I mean, we have seen almost about 300 to 400 patients in one day doing their testing and checking some of them. We have been pretty active. And this mobile clinic that we have, alhamdulillah, has a big sign of Muslims serving humanity. And
So you must be stopped with that sign. You must be stopping some people who don't want to be tested by Muslims, because according to statistics, 1/3 of the people are afraid of seeing a mosque or anybody close. And in another study, I saw someone who was served by a Muslim clinic didn't tell their relatives that she was served by Muslims.
Very interesting point that you mentioned. Very interesting that in the beginning, when we were trying to put the wrap on the truck, that was an ambulance that was donated to us by our county. They were trying to retire the truck. So I went there, I made a speech, and alhamdulillah, they donated it to us. So now we were thinking about putting a wrap, and we all just sat around and we said, well, what should we do? And most of our members were against putting a picture of a hijabi doctor on the truck. So we have a picture of a hijabi doctor and 2 other Muslim doctors on it. And people were like, you're going to be yelled at, honked at. Well, to my surprise, I drive that truck 50% of the time, taking it to from the masjid where it's parked to our remote testing sites or the clinic sites. And all what I get is thumbs up. It's so interesting. We have a stereotype in our mind, that thought process. Okay, everybody is going to be hating Muslims. That's not true. It's only a handful of people. And, those handful, we can change the narrative by providing the service, and they will change their mind. We had few patients who came to our clinic. They were kind of reluctant to come to a Muslim clinic or to be seen by a Muslim doctor or to be, received by a Muslim receptionist with a hijab on. And by the time they left, they just left a very good, nice, positive comments. And some of them had tears in their eyes. I could not be seen by anywhere, but you guys are doing a great service. You provided the free care, which I couldn't get anywhere. And we have a dental clinic too that we have established, started one chair.
Let's talk about dental clinic a little later, but tell me, I'm concerned that in May you have a slightly better supply of test kits than now. I thought in 4 or 5 months the supply should have been better. What is the situation in your clinic, Adil Sayed?
Yes, absolutely. I think test kits, as Dr. Ahmed alluded to, were originating with coming from the county. The county departments of public health were really the ones in charge of disseminating test kits. Over some time now, we have direct contracts with many major labs in the area, so we have ramped up testing, and the county is also offering more testing. The testing is more available here, at least in Los Angeles, in the Los Angeles County area. Patients are coming in. I think you understand that serving in underserved Black and Brown communities such as South Central Los Angeles, where Ummah is situated, the effects of COVID are far more disparate in its impact, that the community is impacted more. And we've saw from COVID that some of the health disparities that have existed previously are just exacerbated in the community that we serve. And that included access to testing, right? We see celebrities and athletes are getting tested, whenever they need or whenever they want to think about it. Yet, access to testing in the inner cities is still few and far between. I think it is getting better, but I think it continues to showcase the inequities in healthcare that we have long understood, and many folks like Dr. Ahmed and others serving and community clinics have understood for generations.
So you have better supply of test kits as compared to in Florida. I'm surprised the president is from Florida, and I thought he has good connection with the governor there, but you have short on that. How is the situation of protective gear? Do both of your clinics have proper level of PPPs?
Yeah, early on for us, I think securing PPE was extremely important. We're part of other clinic consortias in Los Angeles County, and the resources to get many foundations were stepping up to the plate and helping with donating PPE as well. Our staff are out there testing in our parking lot. We're not doing testing actually inside the clinic. We have a separate tent set up outside in our clinic locations to mitigate the risk for patients who may be coming in with symptoms and testing them outside. And those staff members are fully protected in PPE equipment, as well as visits. Right, I think how we practice medicine has also changed. I think that Dr. Ahmed can allude to as well. For community clinics such as Ummah, up until COVID, we were not able to do telehealth visits, or everything had to be face to face. And so we switched almost on a dime. In 6 days, we had to get our telehealth equipment ready to go, train our staff members, and then more importantly, get our patients accustomed to the telehealth experience. It's very different from seeing your physician over the camera and them trying to diagnose you and following up. So that's been a very interesting area. And so the use of PPE equipment has definitely been rationed, and we're trying to use it as sparingly, but when necessary as possible, because we don't know how long this pandemic will last and where we are with the vaccine. So that's where our situation is.
How is PPP is easily accessible, Dr. Shakil, to your area?
Yes, the PPEs are not a problem. In the beginning, like Brother Adil was saying, we had some difficulty in the first few weeks, but then we teamed up with our Seminole County Health Department, and they provided us with the gear, with the respirator mask. So we were okay. It's been a little challenge wearing those PPE in 110-degree temperature outside. That's another story. But alhamdulillah, we had no problem with the PPE. We had a little getting short on the testing kits as of late, but otherwise we've been doing okay from the testing standpoint.
So of course, the clinic which Adil is president of, it must be big. You have what, 60, 70 employees there?
Correct. We have 65 full-time employees, alhamdulillah, and we have 2 clinic sites, and we're going to be opening a full dental clinic location, inshallah, the first quarter of next year. I think to a point that Dr. Ahmed was saying earlier, some people, they walk by our clinic signs and they see, Ummah Clinic, healthcare for all inspired by Islam, and they say, I've never interacted with a Muslim, and this is my first time interacting with Muslims when they walk into the clinic. But I think what's unique for us is about 98% of our patients and employees are not Muslim. We are not specifically serving the Muslim community, although we welcome all patients, even if they are Muslim. But more importantly, we're so happy, and I can share testimonials with you with staff members who are not Muslim, who are proud to be working for a Muslim organization because of the type of treatment they receive, the type of gratitude that patients give, that donors give, that other community stakeholders give. So it's really been a unique situation to observe, I guess, from afar, and those dynamics and how they play out.
So what percentage of patients you say are people of other faith?
So about 99% of our patients are people of other faith communities.
And how much of his staff is of other communities?
About 99% as well. Very few Muslim on staff. I mean, our board, the Ummah Clinic was founded by a group of students back in the early 1990s after the civil unrest and the riots. And it really was a community collaboration on some much needed access to healthcare in the community. So early on, they thought about a mobile unit. And at the time, the community said, no, we're tired of people just coming in and out in our community. We want you to get a physical location. So back then, City Council member Rita Walters, she actually donated a county facility to these students, Muslim students, many of them who are still involved in practicing physicians and professionals in their own right. And over the years, when we became an FQHC, or federally qualified health center, some of the dynamics of our board of directors changed, but many of the founders now serve on committees of the board of directors, or they're involved in other capacities as well. But since that time, the impetus has always been to serve the community where we are. We are always open to Muslim patients. We have Muslim patients who come, but they're a very small percentage of the overall population that we serve, which is about 75% Latino and 25% African American.
What is the situation in the clinic which you have, Dr. Shakil Ahmed?
I think same here. About 75% of our staff is actually Muslim, and most of them are the sisters, and they wear hijab. So they're just like, like an advertisement. Okay, we are here to serve. But we have about 25%, including some mid-level providers who actually are non-Muslim. But we are a great team there. Patient-wise, almost about 95% of our patients are non-Muslims.
That's
And I would say,
interesting. So both of your clinics, one very large one and one a small one, both have same thing. The research which I read in Foreign Policy says that these 70 clinics which they surveyed, 50% patient are Muslim and 50 people of other faith. But it seems to be a different type of trend in the institution which you're serving. When was your clinic established, Dr. Ahmed?
it was almost about 2.5 years back.
Okay.
And our target population is actually non-Muslim. I mean, we had Dawa in mind when we set it up. So we had big billboards on the highways that we actually pay for. We have a sign, Muslim Serving Humanity, the clinic, and the address on them. We send the flyers to the local churches. The local leaders, such as Mayor of Longwood, he's a great supporter. He comes over to the clinic often, and he's got a big fan base there on the Facebook and the social media. And whenever he comes, he makes a video, and the videos, I mean, he shows it up that, okay, these guys are doing a great job. And then right after that video, we see a surge of patients registering. And most of them are, I mean, this is predominantly a white community. So we see the white Americans, most of them, and then some of them Latinos, of course, they are in the mix, and the blacks too. I would say 25% Latino and blacks, but most of them are white, and they are that kind of white who come from the churches. So we have got great support from the local churches. We have offered them that if they want, we can bring our truck and do the free clinic right in your parking lots too. And we have done about a couple of them in the past.
You're watching Muslim Network TV. This is Imam Malik Mujahid, and I'm talking with Adil Sayed and Dr. Shakil Ahmed, both of them leaders of clinics run by Muslims, but serving everyone in the neighborhood. We'll be right back after these messages. Welcome back to Muslim Network TV. Before the break, we were talking about the number of patients which you are serving, and they are people of other faith communities, and Muslims are doing it, and you call it inspired by Islam. Is it on the board, inspired by Islam?
Correct. It's Ummah Clinic, healthcare for all, inspired by Islam. That's our tagline.
All right. But one of the things which the community health clinics are required by law to have patients serving on its board. So do you have a board on which patients are serving?
Absolutely. Part of being a federally qualified health center is that over at least 51% of our board members have to be patients that come from the community, because it shows that we are responsive to the community, that we're listening to the needs. And for us at Ummah, alhamdulillah, we're about 60% of our board of directors is our patients who actually come and get services at the clinic. I think it actually helps in many different ways, because one, it keeps us true to the needs on the ground in the community, and two, you get the front office perspective of how they feel when they walk in, how they're being treated. I think it's been rewarding to work with our consumer board members, or patient board members as we call them, in terms of board development and training. And knowing that they are the leaders of this organization, and ultimately they steer the direction of this clinic. So I think it's been a great blessing to have patient board members as part of the clinic operations and board and governance.
Sometimes you read these federal laws and you say, what in the world it is, especially the tax rules and all of that. But, isn't this a beautiful addition to that civil rights law, that patients are going to be majority of the board, at least 51%, and you have gone beyond that, keeping 60%. How do you select them?
Sure. I mean, I think we one interview, we talked to our providers, right? They are in touch with patients on a daily basis. I myself sometimes, just hang out in our waiting rooms before COVID, obviously, with exposure to risk not being such a big factor, and talk with patients, right? Many community patient, right, if they're willing to serve on the board here, means that they're probably involved in their own communities, on the neighborhood council, participating in politics at a local level. You identify them, and they want to step in, they want to share their experience. Alhamdulillah, we recently had a board member join us 1.5 years ago. She's been an Ummah patient, and next year, inshallah, we'll be celebrating our 25 years of service to the community. She's been a patient at Ummah since day one. 25 years of care we've provided to her family, her loved ones. We've helped identify cancer early in her family and got the treatment that some of her loved ones needed. But that perspective of being a patient for Ummah for 25 years is so invaluable, and the type of experience that they can bring and share with us, and really working with them and identifying. And they might talk to other friends or folks they have in the community, say, hey, would you like to join our board? There is a vetting process to make sure they can participate. It's a very, I think, a rigorous involvement. We meet on a monthly basis. We have to by federal law. Every month we have to meet and review finances and financials. We're doing more video calls now, but you'd be surprised, right? Some patient board members might not have access to internet at home, or computers, or video. So we actually can pay for anything that can enable them to serve. They don't get paid to be on the board, but anything like babysitting, food, transportation, as being part of involved in Ummah's board, we can take care of that for them with a small stipend, and we're more than happy to do that to ensure their participation at our board.
Amazing, amazing law. I appreciate whoever wrote that law. Are you thinking, Dr. Ahmed, for taking it to the level of community federally funded and sanctioned, or you want to keep it at a low level?
Well, it's not a low level. It's from the service standpoint, we've got a big area. From the funding standpoint, we do get some grant every year from Free Clinic Association in Florida. We are not federally qualified health center, but we do work with them. We do refer patients. We have, part of that kind of a network. But I mean, I'm inspired by this idea of getting the patients on board. That is a very good idea. And I'm, like you're saying, whoever wrote the law thought over it good. So right now in our board, we have 3 doctors and a pilot, Brother Atif. And he's good. He's our executive director too. But I think that is something which we can think of and include some patients of our clinic in the board and in the decision-making process down the road.
I wanted to say, the healthcare movement, right? The community health movement, specifically community health clinics and free clinics, started out from the civil rights movement, right? They started in rural America where access to healthcare was few and far between. And it really grew up from the grassroots of serving the underserved and providing access to high quality healthcare. So that mission is, very apparent in free clinics and standalone clinics and federally qualified health centers. I think HHS, Health and Human Services, which overlooks the program for federally qualified health centers, has done a tremendous jobs. Today there are over close to 1,800 community FQHC, federally qualified health centers in the United States, and all of them serving in underserved communities, rural, urban communities, and arguably have better health outcomes than many for-profit health institutions, right? I think we have to look at how health is funded in the United States, where the money is coming from. Per capita, we spend more on healthcare but have the worst outcomes, right? Why is that the case? Because when you put profits over people, you're always going to not make decisions that are in the best interest of patient care and the communities that they serve. So I really think the healthcare movement, be it free clinics or federally qualified health center clinics, are truly going to be what changes the trajectory of healthcare in the United States. And I think many faith-based institutions realize that this is such a great way to serve their communities.
Dr. Ahmed, let me apologize. By low-level serving, I did not quite mean that way. I meant the community, federally funded community health center are a particular genre in itself, as described by Adil. That's what I meant, but my choice of words were not appropriate.
No. Actually, I am not even part of the decision making when it goes to the clinic. I'm one of the volunteer doctors, and I do also take do most of the mobile events.
How come you
I'm
get a license to drive a truck while being a physician?
So actually, when we were getting the insurance, they had to have about 3 names. So Brother Atif, who's the executive director, he said, "Well, do you want to be included in that list?" I said, "Well, that's fine." And it appears like, I mean, I can drive it. It's an interesting drive of a big truck. It's not like my little car. And then I end up being the doctor at the clinic too. And we've got a couple of other drivers too who are actually on the license. But it's an interesting drive. But I tell you, that drive makes you feel proud. Alhamdulillah.
Alhamdulillah.
It's interesting you say mobile clinic. We just got our first mobile unit. Inshallah, it'll be out in the community. It's about a 36-foot long truck, and we are going to be serving the community. And I think it's been more strategic in terms of where we place the clinic. One of our community health centers is on the campus of a high school, Fremont High School in South Los Angeles. It serves the over 2,000 kids that go to the high school, but also the community at large. But we also work with the elementary and middle schools. They call feeder schools of children who will eventually come to the high schools. So the idea for our mobile unit is to take the mobile unit and go to the schools a few times, have a rotation through the week so parents can get access to care for themselves and their children. So it's going to be a 2-room mobile clinic, and inshallah, then we can have linkages to care. But I think the mobile clinic movement is so important because you're bringing the care to the patients, right? Why should concierge healthcare only be for folks who can afford it? Why can't it be for patients who we have to meet them where they're at? Oftentimes when there's transportation barriers, and I'll tell you, we have patients who took 6 to 7 buses all the way from North Hollywood to come to South LA because they appreciate the care that only a Muslim physician and a Muslim institution can provide to them.
Just imagine what it takes them to get there.
Absolutely.
4 or 5 buses, meaning it may be 1.5 to 2 hours sometime.
Yes.
Absolutely.
Yeah.
Absolutely.
Well, Adil, you can get a driving lesson from Dr. Ahmad about the truck.
Yeah, my board told me strictly make sure it's a Class A license and I don't have to drive it. Those things they're so big. I mean, I know an ambulance is hard enough to drive. These things are really large.
Well, we were on public policy somewhat. Of course, you have studied public policy. One of the things which I have interesting experience of trying to inspire Muslim physicians to start clinics. So I remember long before there was any, even Ummah clinic was not there at that time. I was in Florida in a very rural area, and some physicians have invited me. It turned out there were about 11 or 12 physicians. And they were telling interesting stories of people. And there was one guy who used to be actually in KKK. And when he has heart attack, was taken to a hospital, and physician was a Muslim. He said, "I don't want to be treated by this rughead." And of course, he couldn't touch him, but he was the only one. Finally, his wife convinced him and he behaved. So him and 12 Muslim physicians, I was encouraging them to start a clinic. And finally, they did start a clinic, but then they say, well, all poor people are coming to all other clinics and nobody is coming, and they close it down. And that's where this concern came to my thought that why Muslim physicians don't start clinic. But at the same time, I also had this thing, there are so many Muslim physicians, why they do not have any impact on the public policy which deals with healthcare business. I mean, as you heard me, it's still a majority, 24 million or higher number of people do not have, 27 million people still are not covered by Obamacare or any other particular system. So while both of you are engaged in healthcare system, one on the voluntary basis, not funded by the government, and Ummah clinic funded by the government, how Muslim physicians or Muslim professionals in healthcare business are trying to influence public policy when it comes to healthcare. Sorry for long-winded question, but I'm interested not only serving, because altogether you can serve a certain number of people. I know the community healthcare systems in America probably takes care of more than 25% of all patients in this country, but there's much more need, and the debate is there. And tonight there's going to be a debate of vice presidential candidate. Probably this topic will come up. So, who are the Muslims taking interest in this field of healthcare?
Sure, maybe I'll start. I think, look, I mean, there's no doubt that Muslim physicians, by and large, are one of the most, I think, serving individuals in the United States. I think we saw reports after what happened in New York with the response to COVID, in terms of Muslim physicians giving back, as you had stated earlier, Imam Mujahid, about Muslim physicians serving after COVID in New York. And I think just selflessly serving. My father is also a practicing physician. Many of the values and ideas about medicine that I have when I didn't even know about healthcare policy came from understanding he saw patients for free in his clinic, right? He saw people at the masjid who didn't have insurance, who needed some medication or just needed to be seen by someone. He would take them in. He would take in other patients, and I would just hear about it. And I said, why can't they just have insurance like everyone else? And then obviously, as I understood the system as it is, we understand there has to be systemic change in the healthcare institutions that we serve. I think, as you alluded to, almost 1 in 12 Americans gets their healthcare at a community health center in the United States. 1 in 12, meaning that by and large, there are so many at the fringes who will not have access to healthcare, right? The ER rooms are flooded, the urgent cares are flooded. And what are we doing to ensure that they have long-term care for many chronic conditions and other care? Public policy building starts from the grassroots, right? The experiences that Muslim physicians have, that healthcare professionals have. I think I'm more excited that I've even been able to talk to people who are going through school right now and undergraduate studies who are getting to health management policy. I think it's a way that they can synthesize the information and the experience from frontline Muslim physicians like Dr. Ahmed and others who are selflessly serving, but how do they translate that into public policy change? What's the agenda, and what are we, more importantly, going to be asking for based on the experiences we're seeing on the ground? I think that's slowly coming, but I think as we continue to build a momentum and do the work, it happens. And I'll just say this, and I want to end with this. Why stop at Muslim health clinics, right? You don't walk into an agnostic hospital today in the United States. Given the service of Muslim physicians, I think it's time, and I think it's high time to have a Muslim hospital in the United States and plant that flag, because many faith communities have understood that the proverbial flag of them showcasing to the United States their service is actually establishing a hospital. We saw it with the Jewish community, with the Cedar Sinai Medical Center here. We see it with other Christian denominations who also plant that flag. And I think we want to get to a point where we can have established goals and push public policy, but continue to expand our service even from clinics to establishing a hospital one day, inshallah.
Well, Dr. Ahmed, this young man is giving you a lot of challenges here.
Yes. That's been our dream, to have a hospital, but not just one hospital, network of hospitals throughout the nation. I gotta tell you, 10% of the doctors in this country are Muslims. But as far as the healthcare administrators, we don't have too many. So that is when the policy will be, we're going to be a part of policy when we get to the healthcare administration. Not just from the free clinic platform, from our, whatever business we are doing, healthcare business that we are part of. Either we are employed or have our own practice or part of a big practice, or even employed by the hospital. That is going to be changed when we will up our game. So I think it's not time that just, we look for ourselves, for our family, for our job. I think we have to look at the bigger picture. We have to be in this country. Our children will be in this country, and they're not going anywhere. So to become the part of the mainstream and become part of a bigger picture, I think we have to start making plans now. We did have a plan of expanding our clinic, but then there are challenges. You don't, the Muslim doctors, although we've got, quite a few, all of them are not available to be a part of the free clinic system, for example. So that is when you have to kind of look around, you have to hire people, you have to get the mid-levels, to excite them to be a part of it. And, in their own capacity, they're very influential in the hospital committees and the management wherever they are. They've got really sound ideas. But to translate that ideas into the public service, such as at the free clinics, it's a challenge, but we'll overcome it, inshallah. It's, one step at a time, slowly coming.
You're watching Muslim Network TV. You always will find interesting conversation here, which you don't find on the television. We'll be right back after these messages. Welcome back to Muslim Network TV. This is Imam Malik Mujahid, and I'm talking with Adil Sayed and Dr. Shakil Ahmed, who are doing a great service to their communities. And tell us, Adil, you have not been involved in starting that clinic, but you must have heard from the pioneers. And Dr. Shakil, you're not just the pioneer, you're the truck driver as well as physician of your clinic. May God bless you. Tell us, what were the most difficult aspect of beginning a venture like this?
Talking to many of the founders, right? For example, Dr. Rushdi Abdul Qadir, he's in San Luis Obispo now. His brother, Dr. Rumi, Dr. Khalik Siddiq, Razia Sheikh, Altaf, Mansoor, all these founders, right? They were students when they started the clinic, right? I think they had the same.
No, it was sort of a MSA type of project.
Yeah, absolutely. It started from the UCLA campus. It started with undergrad students, graduate students, but I think that desire to make change, right, was the seed that was planted then, right? They didn't know if what they were starting was gonna, inshallah, live out 25 years and grow at the capacity it has. But I think it's the intention was clean, right? We understand in our faith tradition that every action is based by intention, and I think what we can visibly see is, inshallah, Allah subhanahu wa ta'ala accepts their intention for why they started this organization and planted that seed. And I'm telling you, when I heard the conversation where they went to the city councilwoman's office as undergraduate UCLA students and said, we have this vision. And by the end of that meeting, they convinced her, and she walked out of there saying, if you are serious about this vision of serving the community, I will give you a building and you need to run with it. And so that type of give and take relationship, working with other interfaith partners, right? It wasn't just the Muslim community. It was, the Metchek community, the Latin American, Latinx community on the campus of UCLA, the African American community, MLK Hospital at the time, coming together and pooling resources, the Jewish community playing a pivotal role into getting our e-clinical, our electronic health systems ready to go. I mean, it was such an experience where many faith communities came together, but they understood that the reason why they were serving, the reason why this was being created, was that American Muslims could be proud of an institution that will be serving the entire community at large. So I think, the grit, the type of, zeal that we have in our undergraduate years and our graduate study years to really make a difference in the community and planting that seed and knowing that, as Dr. Ahmed said, that we start somewhere and the change will eventually come in the future.
So what were the challenges you faced, Dr. Ahmed?
Well, actually, we did not have too many challenges. The community was very supportive. 3 years ago, there was a building, there was a doctor's office that was kind of abandoned, and they were trying to sell it. That was just about, I would say, about a couple of minutes walk from the masjid. So we thought we should buy it, and we went to the community, did a fundraiser, raised a fund, then we built the office after we bought it. Community supported, and then it started the marketing. we actually went to the CNN. We asked them to cover us. They came and cover. And guess what? Their competition, Fox News, also came in. They interviewed the clinic administration at that time, and it's just, it was really good feeling. So we had, alhamdulillah, a lot of support. We are very connected to our media here, and the media loves the clinic. So they love the social service work that we are doing. They come and they cover every now and then, and a lot of Muslim news come out of this center in the Orlando area, alhamdulillah, and the clinic is a part of it. They always ask about it. So we have, alhamdulillah, a lot of support. All what we want is to get the more providers get excited about this project, be a part of it. And we see that in the young kids who are going to school, they want to volunteer for the clinic. Even not as a doctor, they just want to be a part of it. They feel good about it. They feel good about Muslims duplicating same thing which they see at their schools. They go out and do a lot of free community work, and we tell them, hey, come and work, do some volunteer work for us, and we're going to give you hours. So a lot of kids get lined up. When we go to the events, we see quite a few high schoolers. They get excited and they come in and become the volunteer at our pop-up sites or mobile clinic sites. So alhamdulillah, community is good, supportive. The young ones, they get excited too, alhamdulillah.
So if both of you, Adil and Shakil, both of you are saying that people welcome the idea, people like and people want to help Muslims and neighbors of other faith, then why there are only 70 or so clinics, and why only one ummah which is very large size and others are at a scale which is not to that level? Why more community members are not starting it? Are we not realizing it's our duty to serve our communities? I mean, God Almighty is very clear in the Quran, when it says in chapter Al-Ma'un that a person who lies about the faith or denies the faith is the person who doesn't take care of poor, hungry, and needy. And second thing God says is that he also doesn't care for worshipping God Almighty. So why our teachings, which are so great, are not translating more of these type of services?
Sure. I think I would comment and say that I think it's what you said earlier, it's changing hearts and minds, right? And sometimes it's changing hearts and minds of the community that we're from and that we want to help uplift. I think for a large part, and from my, again, experience, and I think this is different for various communities, community service and serving the community was always seen as an afterthought. And although volunteer efforts are very important and they are always seen as, okay, when I'm done providing for my family, when I kind of have some time left, I'll go volunteer. I think as a Muslim community, when we understand that service to the community is a life calling and it has to be professionalized in how we give back to the community, and more importantly, that these are viable career options for people who want to go and serve the community for long-term sake, then I think the narrative will change, right? It's changing, and going back to what Dr. Ahmed was talking about, the teaching culture, right? The Ummah actually stands for something. It stands for University Muslim Medical Association. And the U in university was because we were always a teaching institution. We had students coming in, Muslim medical students, Muslim residents early on as well, even folks of other faith communities as well, who understand the quality of care that we are providing and that they can learn from is something that will transcend their own practice of medicine in the years to come. So I think those two reasons. One, we have to change the hearts and minds of our community to see service and providing service to the community as not just a volunteer-run effort, although volunteers are very important. That's how we started as an institution. But if they want to graduate and take the next step, how do we professionalize and support institutions to enable to raise the bar of what it means to provide quality service and quality direct service in the community? So I think those are my perspectives on how we can get there, inshallah.
So tell me this: is there a document? I mean, this may be a very silly question. Forgive my naivete. Is there a document which says that, okay, so do you want to start a free clinic? 1, 2, 3, 10 steps to do it. If you need more information, call this number. Is it possible for any one of you to develop a document like that, unless it already exists?
I mean, I've seen variations of it, and I think Imam Mujahid, when I've entertained questions from communities who are looking to start a free clinic, the first thing I tell them is to reach out to, and I think Dr. Ahmed alluded to, a free clinic association or a community health center, because they're all networked at some level. And I think the resources available to communities differ from county to county, even from cities to cities next door to each other. So the context in which many of these clinics are operating in are very different, right? So what works in LA might or may not work in Florida. But the operational aspects of, if you want to get on the path of either becoming a federally qualified health center, or if you still want to stay a community health center, are important. And I think more importantly, the strategic direction, that we don't just do this work because, if every year our impact stays the same, then we're not really growing, right? We're not growing as an institution, as a board. And so to continuously challenge that, and like I said, to do it in an area where we move from volunteers strictly to professional staff who can really carry the momentum alongside with the volunteers and their dedicated support. So there are documents out there, but it's so specific to the relationships that you need to establish with the health officials. And I would love to hear Dr. Ahmed's take on that as well. And I know he's established a lot of those relationships from the scratch.
I think I agree with you. I think the first thing is for us to kind of connect to each other and develop like a manual, which can be a guide for the others. Because the one of the major thing is like, you're hesitant to start something when you don't know how to start. Maybe you have a passion in your heart to serve and to develop a free clinic, but you don't know the steps. So I think those are important things. Matter of fact, I'm just getting the ideas from Imam Mujahid and you, Brother Adil, too. We'll be talking to our clinic administration, see if we can develop something and share with y'all, and see what is your experience to fine tune that and make official kind of a manual and a steps to take to develop something like that. It's definitely not an easy process, but at the same time, once you take the first step, Allah subhanahu wa ta'ala will make the rest of it easy. Then the marketing is really important. Connecting with your local county health departments is really important. Getting the funding is extremely important, because you cannot run the operations without having some kind of funds. Our funding, part of it comes from the Free Clinic Association of Florida, and then our community chips in. If we have building issues, we have some time establishing, for example, the dental clinic. We had to have the dental chairs, and they're expensive, but sometimes cost all the way up to $100,000. And to get that, you have to be reaching out. So have to have some kind of
free clinic which you are mentioning, Free Clinic Association. Is it a national phenomena, or it is a Florida thing?
It is Florida based that we applied for the grant. Yes.
Okay, but are there Free Clinic Association in other part of America?
Yes, there are. There are smaller, major metropolitan areas have free clinic associations, which was a free clinic before we transitioned to become a federally qualified health center. So there are some resources out there.
Okay, so there is a genre itself. Well, we have just a couple of minutes. So last conversation, we talked about starting a hospital. I know a Muslim physician from Imam Dabluddin Muhammad community. He actually was brought to Chicago from, I don't know from where, somewhere from South, to start a Muslim hospital. And a hospital couldn't get started, but he's still head of the emergency services in one of the hospitals in greater cosmopolitan areas. And I always encourage him that, we got to do this thing. And I hope, so is there part of any strategic plan, Adil Sayed, somewhere for the Ummah is to start a hospital?
So I think without letting the cat out of the bag here a little bit, I think we're looking at that. I think when we talked about earlier is how do we scale our operations to get to a point, right? Starting a hospital is not just getting a building and building a hospital, right? They're infrastructure things around operations of running, for example, perhaps an urgent care center, right? So you get used to the operations of running around the clock, the type of care provided. Inpatient services and facilities are usually a different ballgame altogether because of all the federal and state requirements that need to come in. Funding is also a big issue. I think those are all exploratory areas. We are going into our next strategic planning mode in the midst of a global pandemic. These are lofty goals we want to put, but I think I've always led with what's reasonable and what's actionable. And I think if we start, inshallah, working with other clinics, free clinics, and other folks who are interested in helping us scale operations or who have the expertise in showing how this can manifest itself, I think we have to build to scale. And so I think that those are the steps that we are realistically taking, and I think we can take. And I think nationally, right, who's not going to get behind a Muslim hospital, inshallah, right? When the first one comes in, as Dr. Ahmed says, then the next one will come in, and inshallah, we will have a network of hospitals that we can all be proud of as Muslims in the United States. So those steps have to be planted. So, I know this is a public show, and I would like to put the call out that if you're interested, or if you have the public health background, administration, or even context, or want me to talk to somebody, please put us in touch. There's no discussion that's too small, because the goal that we have in front of us is so lofty. And I'm a firm believer that anything worth doing is not going to be established in a lifetime. So we have to put forth the effort, and we ask Allah subhanahu wa ta'ala to accept that effort in whatever way we can, inshallah.
Well, thank you so much. Truly appreciate both of you. Adil Sayyed, amazing job. And Dr. Shakil Ahmed, wow, a physician learning to drive a big truck. I think that itself need to be a 2-minute documentary, I would say. Thank you so much for your work. Truly appreciate you being with us. And Dr. Abdul Wahid and Sherdil Khan, thank you so much for producing today's show. You're watching Muslim Network TV on Galaxy 19 satellite, Amazon Fire TV, Apple TV, and our own website, muslimnetwork.tv. Thank you so much for watching. Peace